Hello, my name is Stephen White. I decided to do the physiology of tumors. So starting off with their microenvironmental physiology, tumors are extremely different from normal tissues and actually have a hostile microenvironment. Looking at the hypoxia, which is a lack of oxygen, it plays a big role as it can cause reduced fixation of radiation-induced DNA damage. So it does provide difficulties when doing cancer therapy, as we will see further in my presentation. Another huge aspect is the tumor vasculature that causes a hostile environment, and that is the channels of tumor nutrition supply, and it is also the tumor cell dissemination, which plays a role in growth and metastasis. Now, hypoxia is a big key here for the difference from normal tissues, as it is a lack of oxygen, and it also has huge roles in the efficacy of cancer therapies. You'll also see, though, that tumor cells will have glucose and energy deprivation, high lactate levels, and then it will also present extracellular acidosis. And the hypoxia microenvironment can resist irradiation, meaning that we can see treatment failure for tumors. Moving on to the physiology of solid tumors, the biggest key is that the vasculature difference between tumor cells and normal cells. In tumors, you can see distended capillaries, leaky walls, and sluggish flow. So you have difference in blood vessels, which can cause problems for cancer treatment when you look at the hypoxia. And then the growth does rely on angiogenesis and vessel growth. And we have seen that you can use the hypoxia as a great way to actually treat cancer by using hypoxic selective cytotoxins, gene therapy, or we can also inhibit angiogenesis. And that's why it is important to know the physiology to realize that if we can inhibit angiogenesis, we can inhibit the growth of tumors. Moving on to glycolysis and mitochondrial physiology, the cellular metabolism is a sign for cancer. You want to keep a close eye on how it is functioning and whether it's normal or not. In tumors, you will see increased aerobic lactate production, as well as LDH proteins. Tumor cells do depend on glucose metabolism since they have a lack of oxygen. And the mitochondrial physiology, specifically in the LDH proteins. And with the LDH proteins, the importance of it is that tumorigenicity LDH deficient cells have much lower LDH, which is a key role in tumor maintenance. LDH catalyzes the interconversions of pyruvate and lactate, and it also deals with the interconversions of NADH. LLPS is liquid-liquid phase separation, and it is a mechanism that has been used to explain the formation of organelles and membraneless condensates. LLPS can be used to increase the efficacy of cancer therapy by restoring chemosensitivity of cancer cells by using MED1 condensates in resistant cancer cells. Now, there are three main physiological barriers when delivering antibodies to tumors and other macromolecules. The three mains are heterogeneous blood supply, which limits delivery of blood-borne molecules to well-perfused areas. The next is elevated interstitial pressure, which reduces extravasation of fluids and macromolecules and also affects radially outward convection, which opposes inward diffusion, which will decrease the amount of antibodies and macromolecules that you will be able to even deliver to the tumor. And then lastly, we have large transport distances in the interstitium. This increases the time for slower macromolecules to reach distal regions of the tumor.